When I was looking for a position, I wanted to look for something where I didn't have to think about the behind the scenes, the hiring, the firing, dealing with insurance. I wanted a place where I could just practice medicine. And being part of the EyeCare Partners brand has allowed me to do that. The people at the corporate deal with all the headaches, and I get to do the fun part of treating patients and doing the best I can.
I like that I can just come in and focus really on patient care, and all the incidental stuff is not really in my head because that's all taken care of by administrators. It makes work easy so that I'm not coming home stressed every day.
We have a good group of highly trained administrators. The administration then really trains each location having a local manager. They also train opticians, technicians, and support staff. So if you have a technician that retires, for example, and you bring in a new technician, they already have all of the fundamental skills, the vocabulary, and they've been taught how to work the equipment. So you, the physician, then can kind of take them from that level and customize what you personally would like them to do and how you would like them to do patients.
So EyeCare Partners done a pretty instrumental job in having us have the equipment and the supplies and everything we need. It's opened up more pathways for us to not only treat our patients better, be able to have the technology we need to do so, and it's constantly growing and changing.
If you were, in your own private practice or solo, office, to obtain any of the imaging modalities can easily cost hundreds of thousands of dollars, $200,000. Being under EyeCare Partner, they're able to negotiate deals with a lot of the companies to be able to obtain equipment at a reasonable price, making it so that you can actually have that equipment versus waiting until it, goes on sale.
So all the clinics got updated with the Argos, which is the latest for cataract measurements. We have Pennicams, which are some of the best tomographers on the market. As far as some of our surgical equipment within the offices, we have some more advanced laser SLTs and YAG capsulotomies, or YAG lasers that are much more intuitive to use than the older technologies that we've had before.
I've been able to do research. I've been able to participate in advisory boards for big pharma companies. I've been able to help with the new geographic atrophy drugs, which has always been a dream of mine. I love watching the advancements with stem cells, for example, and in other practices, even ophthalmology, optometry practices around the world, there's not very many opportunities like this.
When I came in, I had one set of lenses, and I work in multiple rooms in different offices, and I just asked simply, do I have the ability to order more material, more lenses, more tools? And it was, it'll be here on Tuesday.
I'm sure there's at least one clinic somewhere under EyeCare Partners, somewhere in the nation, since they own so many practices, that has already implemented that. So the coding, the billing, the reimbursement, all of that has already been figured out. You're not, making a new wheel. It's already been established.
Our practice has grown, but now we have a network. And so we have colleagues from around the country that we can meet with, we can learn from. There's numerous committees. There's the physician-led leadership. And so any of the business decisions, the providers are part of that process itself.
A sense of collaboration across different groups. I think Cincinnati Eye Institute has a long track record of being a leader in ophthalmology, and then now we're joined with other practices that have similar track records across the country. And I think it's really open to communication and collaboration, really brings new ideas and new technology to us sooner.
Knowing that whatever I kind of needed or wanted in my practice for patients is always something that I could ask for or suggest, and that they would actually look into it and try to make it happen. Not just for me, but also for my patients. I liked that a lot about this specific location. I think I'm able to help patients as much as I possibly can and offer everything that I can.
We have scribes who take care of all the computer work so that I can sit face to face with the patient, talk to them, discuss their condition, and treat them appropriately. The reason all of us went to medical school is because we want to take care of patients. With the way healthcare is right now, there is so much of regulation that it's taken the joy out of practicing medicine. What EyeCare Partners does, it lets me do what I want to do and what I was trained to do, and that's to take care of patients.